Today we are going to
tell you about Tourette Syndrome. Tourette Syndrome, TS, or simply Tourette's, is a common neurodevelopmental disorder with onset in childhood characterized by multiple motor tic, at least one vocal phonic tic.
the disorder is named for Dr. Georges Gilles de la Tourette, the pioneering French neurologist who in 1885 first described the condition in an 86-year-old French noblewoman.
Tics are sudden, repetitive, non-rhythmic movements, motor tics, such as including sniffing or touching objects, hopping, jumping, bending, or twisting. Utterances, phonic tics that involve discrete muscle movements. Motor tics are movement-based tics, while phonic tics are involuntary sounds produced by moving air to the nose or throat, such as throat clearing, snorting, grunting, or barking.
Tics are movements or sounds that occur intermittently and unpredictably out of a background of normal motor activity, having the appearance of normal behaviors gone wrong. The tics associated with Tourette's change in number, frequency, severity, and anatomical location. Waxing and waning, the ongoing increase and decrease in severity and frequency of tics, occurs differently in each individual. Tics may also occur in bouts, which vary for each person. Coprolalia, the spontaneous utterance of social, objectionable, or taboo word or phrases, is the most publicized symptom Tourette's, but it is not required for a diagnosis of Tourette's, and only about 10% of Tourette's patients exhibit it.
Most cases of Tourette's in older individuals are mild and are almost unrecognizable. Adults with TS presenting in clinics are atypical and represent a biased sample. When symptoms are severe enough to warrant referral to clinics, obsessive-compulsive disorder, OCD, and attention deficit hyperactive disorder, ADHD, and are often associated with Tourette's in children with tics. The additional presence of ADHD is associated with functional impairment, disruptive behavior, and tic severity.
The exact cause of Tourette's is unknown, but it is well established that both genetic and environmental factors are involved. Genetic epidemiology studies have shown that the overwhelming majority of cases of Tourette's are inherited, although the exact mode of inheritance is not yet known and no gene has been identified. In other cases, tics are associated with disorders other than Tourette's, a phenomenon known as Touretteism.
A person with Tourette's has about a 50% chance of passing the genes on to his or her children, but Tourette's is a condition of variable expression and incomplete prevalence, as not everyone who inherits the genetic vulnerability will show symptoms. Even close family members may show different severities of symptoms or no symptoms at all. The genes may express as Tourette's as a milder tic disorder, provisional or chronic tics, or as obsessive-compulsive disorder symptoms without tics. Only a minority of children who inherit the genes have symptoms severe enough to require medical attention.
Some forms of OCD may be genetically linked to Tourette's. A subset of OCD is thought to be causally related to Tourette's and may be a different expression of the same factors that are important for the expression of tics.
Many people with TS may not realize they have tics because tics are more commonly expressed in private. TS may go unrecognized or undetected. It is not that uncommon for the parents of the affected child to be unaware that they too may have had tics as children, because Tourette's tends to subside with maturity, and because milder cases of Tourette's are now more likely to be recognized. The first realization that a parent had tics as a child may not come until their offspring is diagnosed. It is not uncommon for several members of the family to be diagnosed together. Parents bring children to a physician for an evaluation of tics, become aware that they too had tics as a child.
Tourette Syndrome is found among all social, racial, and ethnic groups and has been reported in all parts of the world. It is 3 to 4 times more frequent among males than among females.
Thanks for watching
This Adventurous Kids episode.
Yeehaw!
Yeah!